Hi, I'm Brian Lane, certified podorthist with Dr. Comfort. Today, we would like to discuss proper dispensing and follow-up of the diabetic shoes. Now, after the proper measurements and ordering of the shoes, it is now time for dispensing. In the box, you'll find several different things. First of all, most obvious thing is the shoes. You will find the shoes that the patient has ordered. In this case, it's the Delight Black. Additionally, you'll find the inserts that you had requested, whether it was the gel, the customs, or the heat moldable inserts. In this particular case, following the prescription, our patient here, who is Patty Hale with Dr. Comfort, has ordered the heat moldables, so we're going to make sure we're trying those on with the heat moldable. Additionally, in the box, you'll actually find some blue filler inserts. This helps with proper fitting if we need to snug up the fit or tighten the fit of either shoe. Very useful tool. Also, you'll find a calendar sticker sheet. This is great for not only your records, but also the patient's records. Additionally, you'll find a catalog. On this catalog, a very helpful, very useful marketing tool on the back. You'll actually find your facility name and contact information on the back, either to distribute to future patients or your current patients to help them pass on to their friends, as well as some marketing literature. In this case, we have the marketing the slippers as well as the socks that's been placed in there. A very helpful and useful tool is our shoe horn, very helpful especially with what we're going to use right now, as well as shoe care instructions, including the break-in period for the shoes as well. This will be one of the several forms you want to dispense with the shoes, and we'll get to that in a few minutes here. Now, to properly dispense the shoes, a couple things you want to do prior to putting the shoes on the patient's feet is you want to prepare the shoes. By doing that, you want to place the proper inserts in the shoe and check for debris. Make sure there's no debris in the shoes to cause any sort of sores or irritation. The next thing I typically like to do is flex the shoe at the break point as well as squeeze the counter. Kind of wakes up the shoe, gets it prepared for the patient's foot. So in order to do this also, you see this is our Delight. It has Velcro straps, so I unvelcro it as much as possible. And this is where proper demonstration actually is helpful for the patient and how to properly don the shoes. Okay, so we've opened it. Of course, if we have a lace style shoe, we want to unlace it completely. So to properly don those shoes, again, demonstrating good proper behavior, you want to use the shoe horn and slide the patient's shoes, foot right inside the shoe, almost use it as a slide. Great little tool. And pull the Velcro strap to a snug but comfortable fit across the patient's foot. Here you want to make sure that the Velcro strap is at a comfortable distance, not too short or overlapping too much. Then of course get the other shoe on. Always have the patients try on both shoes. Again, unvelcroing and completely checking for any sort of debris, placing the insert inside the shoe and flexing the shoe, and also at the counter squeezing that counter. So again, proper donning of the shoes, slide it right in there. Have the patient slide it right inside her foot, and again, same things, Velcro strap right across, make sure it's a snug but comfortable fit. Then what I do from here is actually have the patient walk around. So Patty, if you wouldn't mind walking around a little bit for me. At this time I'm observing fit, making sure there's no slipping in the heel, looking for the break point of the shoe, matching up with the ball of her foot. And from here, I'll ask her to come right back here after she's walked a few times. In some cases, you could actually ask the patient how the patient feels in the shoes, but also remember, if the patient has no sensation, you could stop right there. If they have no sensation, it is kind of a moot point in that particular case. So the three areas you want to check for when you're checking for the proper fit, the first one is the length. You want to make sure that you're pushing not down from the top, but from the beginning, from the end of the shoe, pushing in the leather to make sure there's anywhere from 1/2 inch to 3/8 of an inch room at the end of the shoe. So as I do that, I feel her toe right about there, and that's adequate room there. We'll also check the right foot as well. Same thing, I feel her toe. Remember, it's not always the great toe. Sometimes it's the longest toe, which is in some cases the second digit. The next thing I check for the widest part of the shoe should be the widest part of her foot as well. That's matching up the first and fifth metatarsal phalangeal joints right there, and those seem to match up pretty well as well. You could also reach on the inside of the arch of her foot, the medial longitudinal arch, to make sure that's properly fitting, as well as check her heel. Make sure there's no significant slipping, because a little slipping is okay, but significant slipping that would cause an irritation is not. Now we've established proper fit. At this time, it is very important the patient receives several forms and it's documented that they have received them. The first one came with the shoes, and that is the break-in period as well as shoe care instructions. Those will come with every pair of shoes. We usually review this with the patient, letting them know that they should break them in slowly over the course of the next few days, only wearing them 30 to 60 minutes indoors for that first day especially. Always keeping an eye on their own feet, making sure there's no rubbing, redness, or irritation. An additional form they should actually receive is the patient authorization or proof of delivery, as well as the warranty statement. The warranty statement that we have enclosed in our manuals, you can actually find, states that it's a 30-day return policy if the patient has any problems with the shoes. And lastly, the patient should also have the Medicare supplier standards. At this time, there's actually 26 supplier standards, which all these forms can be found on our website as well. So after you have made sure that the shoes are properly fitting as we've done, you've gone over each of the forms, now it's time to schedule the 2-week follow-up appointment. I typically use 2 weeks just for a good time frame of them to break in the shoes. Now, during the follow-up, you want to be sure that you review the recommended maintenance with the patient. You solicit feedback from the patient and prescribing physician as necessary to determine the effectiveness of the shoes, the wear schedule, the tolerance, the proper donning and doffing. You also want to make sure you review any changes to the treatment plan based on the patient's current medical condition. You want to continue to assist the patient until they have the optimal level of fit with those shoes. Now, ideally, this should be conducted at that 2-week follow-up appointment, but obviously as needed if the patient actually requires it. This concludes our dispensing and follow-up instruction video. Thank you.